5 minutes till we're live.
Hi, my name's Steve, and because I knew how to do CPR when I was at Parkrun, I was able to help restart a heart, and through what you're about to learn, you too could save a life.
Afternoon everyone, my name is Maya. I'm one of the doctors with the air ambulance charity Cancer in Sussex.
I'm Stu, I'm one of the paramedics also from the air ambulance in Sussex.
On behalf of everyone at the air ambulance charity Cancer in Sussex, thank you so much for joining us today on a very special day, which is a National Restart a Heart Day. Today we're going to show every one of you how you could save a life.
And you only might need these skills once, but we want you to be confident and ready so that you may have the opportunity to save someone's life.
The main thing is really to remain calm, and with the skills we're going to teach you today, you should be confident that you can deliver CPR and save someone's life.
We can't hear you. However, if you want to put any questions in the chat, we will respond to them either later or as the session goes on.
So, why is this important? Why is CPR important? We'd like you to think about this and have a quick discussion either with your teachers or amongst yourself in your room or with your colleagues at work, and think what are you trying to do before the ambulance arrives, and put it in the chat below. While we are thinking about the questions, we'll just tell you some facts about cardiac arrest and CPR. So, over to Stu.
Okay, 1 in 10 out of hospital cardiac arrest survives to discharge.
Chances of survival fall by 10% every minute CPR and defibrillation is delayed.
And this is really important. 80% of cardiac arrests occur in people's homes, which means sadly it could be a loved one, friend or family member.
Worldwide, other systems paved the way by achieving survival rate nearly double ours because of the high rates of bystander CPR and public access defibs, which is why we're so keen to teach you how to do CPR.
Here's an amazing statistic. In the UK, around 30,000 cardiac arrests a year.
And as a charity, Air Ambulance Cancer in Sussex attains roughly 300 a year, 300 cardiac arrests a year. Do we have any questions in the chat? Okay, there is one coming. CPR is important to save a life, absolutely, which is why we are doing this session today and which is why you have joined us, which is brilliant.
Yeah, and what CPR does, when you're pushing on the chest, that pumps of blood around the body, and the blood carries oxygen, and that pushes that oxygen to all your vital organs, your brain, your heart, and other important organs.
And that is really, really key, because that's the help the patient needs or the person needs before the ambulance gets there, as one of you has already put on the chat.
So hopefully you are now sitting in front of the screen in your classroom on the floor with some space around you, with either some rolled up jumpers or a cushion, or if you may have a mannequin as well.
So, are we all ready to become lifesavers then? I think we should be, but we're missing something.
Yes, we are missing some bits and pieces, I think.
We are missing a mannequin.
Yeah,
This
one
is
made
our
earlier.
mannequin. This is Risa's end, and
this
Stu's
is
going
mine.
to use a pillow instead, because at home I'm sure most of you don't have mannequins, so it's really good to practice on the pillow. So, before we go into the CPR, we'd like you to watch a little video about our charity, and we'll see you shortly.
We're your local air ambulance charity. We hope you never need us, but every year thousands of people do. And if you do, we'll be there to fight for your life.
Our helicopters are flying emergency rooms. When there is a life or death call, we bring specialized doctors, paramedics and treatment to the scene fast. And we don't stop, 24/7, 365 days a year.
Last year, our crews responded to 9 incidents every day. That's over 3,000 incidents.
It costs $45,000 a day to run our life-saving service, making sure our team get to where they are urgently needed.
Without you, we can't keep flying. Without you, we can't save lives.
Well, I hope you enjoyed the little video, and now let's go straight into CPR.
Oh, hang on, Stu. First, we need to see who actually needs it, don't we?
That's a really good point. So what do we need to do first?
Well, I think first we need to check for danger. So we need to make sure that we are safe to provide resuscitation, that the casualty is safe, and the people around us are safe. So what are the danger things we're talking about?
So it's really, really important that you make yourself safe. It's so very easy to see someone unwell and you want to help them. And it's very easy to miss the dangers around you. Things that can fall on your head, the traffic, the roads, other people around you may be the danger themselves. So you need to be really mindful of your own safety.
Okay, so second thing, so first is check for danger. Second thing is we need to recognize who actually needs us, needs help.
So let's first of all roll your patient on the back.
Okay.
And then shake their shoulders and call out.
Hello, are you okay? Are you okay?
Okay. And see if you can wake them. Now, if you can't wake them, what you now need to do, get on the phone and call 999.
What about if they are not waking up, but they're making some sort of breathing, but not quite right?
So sometimes when patients go into cardiac arrest, especially if it happens in front of you, they have this very weird breathing. Sometimes they don't breathe at all. Sometimes their breathing's ineffective. It may be very noisy. It may be snoring, or it may be long gasps, just looking like a fish out of water.
Okay, so if you're concerned that the patient's not waking and they're not breathing at all or not breathing effectively, you're going to call 999. So that's the third thing we're going to do. And we'll hand you over to our expert in dealing with 999 calls, who's Lauren, our dispatcher. And we'll see you shortly.
Hi, my name's Lauren. I'm one of the dispatchers for KSS. My job is to work in the 999 control centre and taking a look at all the calls that come in for Kent, Surrey and Sussex to help determine which call is best for the air ambulance to attend. When you call 999, one of the first questions you're going to be asked is the patient breathing? Followed by, is the patient awake or conscious? So you're going to need to know your address. If you are somewhere rural or you're on a motorway, you're outdoors, then you might want to already have the What 3 Words app downloaded. This will give you 3 words that you can give to the call handler and they will be able to pinpoint your exact location. If you have small children or you've got younger siblings in the house, it's good to have them already prepped to know their address or to know where they can turn if they don't, such as to neighbours or to friends. You might also get asked about if there's a defibrillator nearby. The ambulance service is able to tell you where the local one is. They'll give you an address and they can also give you a code so that you can access it. If you've got someone on scene with you, you might want to have them waiting at the door to wave the crew down and to bring them in to the patient. If you're on your own, you will continue doing CPR until the crew arrive. The call taker will let you know when to go and open the door, and then you need to head straight back to the patient and carry on with CPR until the crew are in and next to you and ready to take over. If you have any pets on scene, then you may want to consider somewhere safe and out of the way to keep them whilst the crew arrive. So a quick recap on what we've discussed today. You're going to be asked if the patient's awake or breathing. You need to know your address or have your What 3 Words location to hand. You may also want to consider having your children prepped with their address or to know who they can turn to in an emergency. You may be asked to go and get a defib, but the ambulance service will give you all the details for that. If you've got someone on scene with you, you may want to get them to wave the crew down as they arrive. And if you're alone, wait for the person on the phone to tell you when to go and open the door. Finally, if you've got any pets, keep them safe and out of the way.
Excellent. So now that you're all experts in what happens with 999 calls and how they are dealt with in the background, before we start CPR, we're just going to recap. So first thing, when you come across someone who's unresponsive, you're going to check for dangers. Second thing, you will recognize whether they need chest compressions. Then you're going to do 999 call. And now we're going on to CPR. So Stu's going to tell us how to do that.
So kneel beside your cushion, pillow, or mannequin or whatever you have in front of you. You get your arms nice and straight, and you get the palm of your hand. It's going to be going into the centre of the chest. Okay, lean over your patient or pillow or cushion, and then you are going to do compressions. You're going to push down about a third of the way of the chest as hard as you can, and you're going to try and do 100 a minute. And we go.
And how quick you said 100 a minute? How do
Yeah.
we know what 100 a minute is?
So it's really difficult. So some people pick a tune that they like. Now, because I'm getting old a bit and I was a child of the disco age, I like Staying Alive. I think it works really well. So, Maya, are you ready?
Yeah. 3,
So, 2, 1. Staying alive, staying alive. Staying alive, staying alive. It's as simple as that.
So, should we go through that once again?
Yeah, I think we should do it again. Okay, so kneel beside your patient. Okay, arms out nice and straight. Don't forget, this part of your palm is going to go in the centre of the chest. Lean over your patient, find the centre of the chest, and a third of the way down, start doing your compressions.
You singing?
Should we sing one more time? Let's put them through our bad voices. Staying alive, staying alive. Staying alive.
Okay. So,
Now,
what's next?
we think there's something else that's really, really important that we know helps patients, and that's using a defibrillator. Okay, and here's one we have here. We're just going to explain this to you. They're really, really, really simple to use.
So these devices assess the rhythm and they will deliver shock if the shock is required, and they will not cause any harm. If the shock is not required, the device will instruct you not to deliver shock and just to continue CPR. And we know that when using a defibrillator alongside the CPR, it gives much better chance of survival.
Yeah, they're very easy to use. They've got prompts, and you just follow the sequence of buttons. Okay, access. When you dial 999, you will be told where your closest defibrillator is. Okay, I'm just going to turn it on, and it will start to tell me what to do.
Call emergency medical services now.
So,
Adult mode.
as we discussed
Follow
earlier,
the voice prompt calmly.
you call 999.
Remove all clothing from chest and stomach.
That's the
Rip
patient.
clothing if necessary. Take out the pads from the bottom of the device.
Taking the pads out.
Tear open the pads packaging.
We've already done that. We've torn the packaging open.
Look closely at the picture on each pad.
So each pad's got a picture.
Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture. Peel off the pad labelled 2 and stick to the bare skin of the patient, exactly as shown in the picture. Do not touch the patient. Analysing heart rhythm. Shock advised. Stand clear. Press the flashing orange button now. Shock delivered.
Should we start chest compressions now?
And then start chest compressions.
Begin CPR now.
And the machine
Press the
will
flashing
prompt
blue
you
I button
and give you some
for
timings
CPR.
of the compressions.
First.
Here we go. And that allows you not to sing. Okay.
System shutting down.
So, should we just recap
Yes.
what we've gone through? So the steps. So first we're going to check for danger. Then we're going to check on the person whether they're responding to us. If they're not responding, we will then call 999, start CPR, and then if we have access, we will deliver defibrillation as instructed by the actual device.
Absolutely. We're now going to go to a patient story. This is Steve Harley, who is he performed CPR on his dad, and his dad survived. So we're now going to go to our patient story.
Hi everyone, my name's Steve, and I'm so glad that I knew how to perform CPR. When my father collapsed after walking his dog, my mum found him within only a few minutes and managed to call 999. Luckily enough, I only live a few doors down and managed to be there pretty quickly. When I saw my father unconscious and not breathing, I knew that I had to perform CPR. I managed to perform it and keep him alive until the crew from KSS arrived. Anyone can give CPR, it doesn't matter whether you're young, you're old, you're not going to hurt them and you're not going to make that situation any worse. You have the chance to save a life, so don't be scared or worried about doing CPR. KSS cared for my dad and he's made a great recovery, but if I had not been there, things could have turned out very differently. Just remember what you have learned about CPR today and the difference that you could make. You just never know when you might need it. So why not encourage others to learn about CPR? It's something that anyone can do. One day you might find yourself in the same situation as me with your loved one or your friend, and you have those skills to make a difference. Thank you for your support and spending time with KSS today.
Excellent. So we've got some questions coming. So one of the questions is, can you kill someone by doing CPR? Absolutely not. You can only save someone's life by doing CPR. So if someone requires CPR, please do it. You cannot hurt people by doing CPR.
Should we check for a pulse at any stage? No. When you try to find a pulse, you'll stop doing chest compressions, and that's bad. If the patient starts getting a really good pulse and starts coming round, they may push you off, but you keep going until told otherwise by a healthcare professional. So
we've mentioned about the breathing, that it may be erratic, and the question is if CPR should still be performed. So if breathing is abnormal in any way, and person is not responding to you, not waking up, you should start chest compressions. And the next one I'm just gonna jump to as well, whilst you is looking at the following ones. Why are the pads placed in that location? So pads are placed at the side of the chest, on the left and the top of the right chest, because that's the direction electricity travels, and it has a highest chance to actually catch the heart and shock the heart to restart it.
Can you hurt the person? No, you can't hurt the person. Chest compressions are very, very hard on the patient, but you can't do them any harm. Can you break ribs? Absolutely. And it's almost a sign that you're doing the compressions well if some ribs get broken. And it's not really the ribs, it's just the cartilage in the middle. So it's 100 compressions a minute, and you don't stop. You just keep going. Now, if you're on your own, you're going to get very, very tired. If more people arrive, think about changing every 2 minutes and try not to delay when you swap over. Get someone already ready, hovering over your hands. So as soon as you stop because you're tired, someone will get straight back on the chest, and it continues that chest compressions. It's really, really key what we're teaching you about the chest compressions. It's all about the chest compressions.
So some really, really good questions. So do we need to remove jewellery before defib, and add to that any metal objects, wires in the bra and things like that? Please remove everything because of obviously electricity there. So make sure the patient is fully exposed. Remove any clothing that they have and any metal object before you use defib.
Should I do CPR on strangers? If I had a collapse and a stranger did CPR on me, I'd be very, very grateful, and I've probably made a friend for life.
I think some more questions are coming up. These are really, really good questions. So keep throwing them, and if you don't manage to answer all of them, we'll try and collect them, and we'll reply to them in an email. So just please continue sending questions to the chat. Yeah, it sounds like coming, not coming.
Cool.
We got one more last question.
Cool. Do we need?
Okay, mouth to mouth. These kept coming throughout the sessions today. The emphasis is on the chest compressions because that's what matters. Don't worry about mouth to mouth. Don't worry about pinching the nose, opening the airway. Well, that is important. I think the emphasis is on chest compressions because that is the key. And one more question.
So just going to show you on the mannequin exactly where, right in the centre of the chest, okay? And that's where you're going to do your chest compressions, okay?
So to clarify where exactly you put your hands during CPR, so center of the chest, literally heel of the hand in the center, in the middle of patient's chest. I think those are the questions. As I said, if you have any more questions, put them in the chat and we'll answer them through email. So thank you so much for joining us today.
Yeah,
don't forget, you all have skills now to do CPR and save someone's life.
Thank
you.
Thank you.
Bye-bye.